Hello everyone, this is Dr.Deepanshi and today we're going to see steroids. Injection bottle always kept on our cupboard, and whether it's needed to put this injection in every other animal which is coming or not. So we will just see that, we will see its pros and cons, and according to the things that this specific drug does, this component does, so we will just categorize it in which condition we should use it and which condition we should not. Okay, so let's go. So often have you noticed that after giving the steroids treatment, have you noticed that pet parent is complaining or telling you that my pet has started eating a lot than normal and also drinking a lot of water? Why it's happening, doctor? Do you know that, and have you noticed it? So let's know what actually occurs when we are giving a steroid injection, a steroid tablet. What actually occurs? It increases appetite, polyphagia. Okay, glucocorticoid effect on the brain. Glucocorticoid, one hormone, that is cortisol. Cortisol gets elevated, shoots up like anything. Fight or flight. We need more energy. We need more glucose. Okay, more glucose means more food. So steroids influences the hypothalamus, regulates that part that regulates hunger. They enhance the signaling of neuropeptide V, and which makes the animal feel more hungry. They need more food. Then it increases the blood sugar level by promoting gluconeogenesis. Tissues will be taking less, and in blood it will be flowing more, and compensatory response to eat more. Okay, I need more because in blood it's getting utilized. Then protein breakdown to more energy, more and more energy. If it's not getting uh, managed by the glucose in more than enough, then protein breakdown will also start. Steroids promote protein catabolism, breaking down muscle tissue for energy, which can signal the body to replenish energy through increased food take. Now when I'm saying protein breakdown, we should remember in cases such as muscle atrophy is there, animal is already very weak, we should not give steroids because it is causing more muscle and tissue breakdown. Okay, we should not use in this case. Now, how it increases the thirst thing? Okay, increased thirst, polydipsia will say, effects on kidney function. Steroids, they decrease the secretion of ADH hormone, also known as vasopressin, leading to increased urination, polyuria. Then water loss, more the water loss, more the thirst mechanism will be there, more and more water intake will be there. Second thing that it does is sodium retention. Many of us must be knowing we should not eat more and more salt, more and more salty things we will have. We want to have more and more water because inside body get dehydrated. More sodium retention will be there in the kidney because it affects, it mimics the action of aldosterone. Okay, then sodium retention increases the body need for water, leading to increased thirst. Okay, now these things we saw. What we saw? Let's rewind it. First thing, increases the glucose. It will increase the cortisol level. Protein catabolism will be there. Decreases the ADH hormone. Increase in the thirst and keeps the sodium. Okay, so then we will see what are the conditions in which we should not use it and what are the conditions we should use it. Okay, let's go. So as I said, you don't want an animal who is already having diabetes to again shoot up more, push and push more and more glucose into the body. No, right? So we will not use in case of diabetic animals. Increase the blood glucose level, worsening the diabetes control. Diabetic cat, dog, hyperglycemia and ketoacidosis, more ketones will be there. Then kidney or liver disease. Kidney or liver disease, already kidney is trying hard to function and worsen the water retention, increase the BP and more stress to the diseased organ. CKD cases, do not give the steroids, do not make this mistake. Already in last video I think on steroids I said do not give with NSAID, do not give the Garodil. Okay, Garodil, don't use it along with that. Active wounds, first and the most important thing that we should remember is what steroids will do: decrease the immunosuppression. Okay, it will immunosuppression, it will cause immunosuppression, not decrease the immunosuppression. It will cause immunosuppression. Whatever the things, healing, everything is going on, it will decrease it. Okay, so in abscess condition and shock condition, we need the immune system to work. Okay, in snake bites, in such cases, we need the immune system. In shock, in abscess, we need this immune system to work properly, to do clotting properly, and to heal. All the pus and everything should come out. These things we need. In shock condition, already body is suffering. We should not give steroids in such cases. In shock condition, we need the body to function properly, because already the organs are in shock. We should not give steroids. Then it comes to snake bite. Snake bite, we want the immune system to flush out fully the venom, but if the immune system gets suppressed, how it will work? Then the fifth point is heart diseases or hypertension. As I said, it will lead to increase fluid retention into the body, will increase the blood pressure and worsening the heart failure and hypertension cases. Okay, so yeah, as mitral valve diseases or pulmonary edema cases, fluid retention, sodium retention, in such cases we should not give it. Okay, so next, moving on to the next slide. So special points in why it should not be used in case of snake bite: it suppresses the immune system, which can interfere the body's ability to process the venom effectively. No matter how much fluid therapy you will give, if you have given a steroid, it will suppress the immune system. Okay, by that time, how many times I have said, so you must have understand the number one point, that it will suppress the immune system. So it can delay the neutralization of venom by antivenom. Okay, slow recovery, potential worsening of the systemic effect like shock and tissue damage. Okay, slower healing also will be there. Okay, and more infection chances, because one thing, you have suppressed the immune system, already the body is suffering with the one snake bite, so it will get, an immune system is not working, so it will be prone to many other problems. More other infections can occur, and delay in healing. And the most very important thing is what it will do: the steroids will delay the coagulation process, and it will increase the bleeding. We need a coagulant, right, in place of bleeding. That type of coagulant we need, but coagulation will not occur, and it will continue bleeding. And one more very important point, as I remembered, by coagulation, always ask in pets proper history. If they have a history of gastric ulcers, then you should not give steroids. Gastric ulcers history also, it will not cause the proper healing, and bleeding will be there. In case in the gastric ulcer will never heal, and bleeding will be there in the motions. Okay, then final slide. That is what it does. As I said, it mimics the natural stress hormone cortisol, and which especially in case of hypoadrenocorticism, in that case also cortisol already in high point is there, and in that also, if you're using steroids, it will cause problem. Now these are the 4 times you should use steroid. Other than that, it's not needed. Okay, not take an injection and the animal has came, we have to stuck the steroid in every animal. Okay, these are the 4 times. Inflammation, if you see the redness, you ask the owner. Any itching is there, is the animal is itching like crazy, you can give. Third, immune suppression cases, immune suppression, autoimmune diseases. Okay, and fourth is lymphoma or cancer treatments. In such treatment, the immune suppression is also, we need immune suppression for that. Okay, so thank you, and thank you for watching this video. I hope we all have learned something, and each day little things we should learn. Even you just read one single page about one single topic, it's a lot. So thank you for watching this video. Please like, share and subscribe. Okay, bye bye.